Sorry about that.
Right.
Do you want me to start? I'm so sorry.
Yeah, I mean, I guess maybe I thought that maybe someone would do like an intro of sorts just to kick the event off because I can't really. Oh, hey, Rachel.
Oh, hi, everybody. Can you all hear me?
Yes.
Okay, thank you so much for joining us, and sorry about the technical difficulty. So, yeah, I can get us started with introductions for each of you. So, I will start off with Dr. Chidima Acholonu. Did I say that right?
Chidima Acholonu.
Okay, sorry about that. She is the current chair and trustee for the postgraduate school section of the NMA. She's a pediatric emergency medicine fellow at Children's National Hospital in Washington, D.C. She completed her pediatric residency at University of Chicago, where she also served as chief resident before transitioning to fellowship. She earned her medical degree from Morehouse College of Medicine, or Morehouse School of Medicine, excuse me, where she was actively involved in the Student National Medical Association, SNMA, and continues to work closely with medical students through SNMA. Beyond her clinical fellowship, Dr. Acholonu serves as the communications chair for the section on minority health, equity, and inclusion for the AAP, and is a current scholar for the Emergency Medical Service for Children EMSC program, where she is working to optimize best practices for utilizing security and law enforcement in emergency department spaces through a trauma-informed lens. Prior to matriculating to medical school, Dr. Acholonu earned her Master of Public Health degree from George Washington University with a concentration in community-oriented primary care, and afterwards continued to work in the school health sector through health education, health promotion, and capacity building with Chicago, Washington, D.C., Baltimore, and Alexandria Public Schools. She is passionate about building and reinforcing a diverse physician pipeline, is excited to engage trainees and early career physicians in the work of the NMA throughout her term. Next, we have Dr. Haben Debasai. She was born and raised in Michigan. She received her undergraduate degree in biopsychology at the University of Michigan and spent a gap year in the city of Chicago volunteering with AmeriCorps before attending Michigan State University for medical school. She moved to Atlanta in 2019 for her residency in obstetrics and gynecology at Emory University, which was completed in July 2023. She's currently pursuing the Gilstrap Fellow at the CDC Foundation and additionally serves as an Emory adjunct instructor at Grady Health System. Her passions are in community involvement, activism, academic mentorship in medicine, healthcare in underserved populations, as well as women's health policy work. She enjoys spending time with family here in the city, reading novels, and enjoying the lush green outdoors of the surrounding Georgia area on her days off. And lastly, we have Dr. Kanisha L. Hall. She is a board certified anesthesiologist, sexuality counselor, published author, and media personality. She's a native of Shreveport, Louisiana. She graduated with honors from Louisiana Tech University with a BS in chemistry, a second BS in bioscience technology from Thomas Jefferson University. Dr. Kanisha ventured to Sagamihara, Japan to complete her fellowship in cytopathology at Kitasato University. She received her doctorate of medicine from Howard University and later completed her residency in anesthesiology at Louisiana State University Health Sciences Center. Dr. Kanisha is currently practicing anesthesiology, perioperative, palliative, and addictive medicine in and across several states. So thank you all so much for joining us. And I will just start off with our first question. Anybody can answer, so you can just all feel free to speak whenever. So our first question is, what unique challenges have you faced as a Black person in medicine and as a woman specifically, and how did you overcome them?
I guess I'll go first. Uniquely, being a minority and a woman in my particular specialty of anesthesiology, and I'm pretty sure my colleagues feel the same, you feel the need to be 10 times as good and work 20 times as hard for 30 to 70 cents on the dollar that your white male counterparts are making. Um, Beyond being financially compensated, you bear the burdens of your community because you know that your demographic is not necessarily being advocated for and have health concerns and challenges that obstacles of healthcare, that healthcare, the systematic um, infrastructure of healthcare creates more obstacles for. Particularly right now, I am on call for labor and delivery at the local Women's and Children's Hospital, where that feeling never ever gets old when I introduce myself to another Black woman about to bring life into this world, that I'm not just here as your anesthesiologist. I am here to make this journey as safe as possible and advocate for you and your child. So, as a woman in itself, there's a burden that we carry. And then being a Black woman, it is a burden that I carry, but also an honor that I care to care for those. I care for all of my patients, but it is truly an honor to care for those that look like me, that don't all the time feel seen.
I can
Thank
go
you so much
next.
for that.
So I think, in pediatrics, it's kind of a unique challenge because it is a specialty that is predominated by women. So you would think that, given that most pediatricians are actually women, that there wouldn't be as many challenges navigating the space as a woman. But I think when you add the duality of being a woman and being a woman of color, it really does add several layers to just what you have to do day in and day out. I think, Dr. Hall made an excellent point as far as just the level of work and effort you have to put in just for the basic acknowledgement of your competency, which can be challenging. But then also when you are a woman in medical spaces and don't necessarily act, small and dainty. So I'm 5'11" and have a very big personality, wear my hair very big all the time. And so often find myself in spaces where other women or men will try to create scenarios to make you small, or like to force you to make yourself smaller in order for them to feel more comfortable, which can be challenging, especially when you're a trainee and you want to just be your full and unfiltered self, but have to kind of navigate this hierarchy space of wanting to be able to get hired in those next stages. I want to be a medical student getting into residency. I want to be a resident matching to fellowship. And so just needing to walk the line of how much am I just going to be me and you can chew or choke, and how much am I going to have to play the game in order to make sure that I support my career livelihood. So that has been a unique challenge.
I'm 5'10" and I feel you. I so feel you. And I'm still going to wear my heels. Go ahead.
Baby, okay.
Sorry, I apologize if there's lag. I can hear you guys fine, but I'm seeing it on my end. But I echo everything that was said before me. I do think that what I will add is, sorry, my lights just flickered. Just going through a lot of things right in my apartment right now. But I think that in my experience, speaking to the personal aspect, I think I really struggled to find representation and mentorship until I finally moved to Atlanta. I think for me, that was something that I really didn't know I needed until I got to medical school and realized no one looks like me. That is my mentor, or in spaces of mentorship, or very few look like me. And so coming to Atlanta and being surrounded, especially in my field, similarly, is also a field that is predominantly women. But being in Atlanta, it's predominantly Black women. And I think it really did something for me, training in a space where not only were my peers people of color and also many women, but also having multiple, I was spoiled for choice in terms of Black women mentors, which was very important for me and something that I never really saw growing up. So echoing kind of everything that you guys previously said, but I think that mentorship And really that kind of overused public quote that you can't be what you don't see. I think I really felt that way. And I really felt there was only one way I could be, kind of coming where I came from and moving here and seeing a true diversity of Blackness really helped me kind of make my decisions on what I wanted to do and what I wanted to specialize in. So I think that is something that's very, I clung to that. But the challenges, were many.
Thank you so much. So for the next question, we kind of touched on this a little bit, but maybe we can expand more. Black women historically have been overlooked, especially professionally. So what strategies have you guys employed to ensure your voice is heard and that you're not overlooked? You said embracing your 5'10", 5'11". I'm 5'2", so can't say much, but embracing all of that, like how are you guys able to make sure you're not overlooked in your profession?
I do really think the mentorship piece is the key to it all. Dr. Hall may agree, but I think having the privilege of having gone to an HBCU for medical school meant that we out here, meant that we had the privilege of being able to form in our earliest identities as a clinician without feeling othered. And so I will always credit that opportunity in those 4 years of really making it that much easier than to enter into white spaces like University of Chicago, being one of just a handful of Black residents in my program and a handful of Black residents in the GME at the institution, but still being like unapologetic of occupying spaces, making sure I'm heard, making sure that I am like making a name for myself and really being just applauded and acknowledged for the work and the effort that I have done. It's not easy, but I do think that when you have other people who have sort of tread that path before you, it allows you to figure out how to nuance it a little bit. So you don't have to totally like change who you are and play the game, but you can figure out like what pieces have worked really well. You can avoid some pitfalls that those who have done it before you have fallen into. And so I do think that mentorship really is a big piece because you really cannot be what you can't see. And it's encouraging to know that it can be done when you see other people who look like you who have done it.
So to piggyback off of what she said, so I have a two-prong approach to this, on a patient on a clinical level, patient to patient, whether, this is a Black woman patient, another minority, patient to patient, I try to, one, always provide culturally competent care, even in and outside of my culture. And two, I have realized at this stage in my career, I'm 16 years into my practice now, almost 17. Oh my goodness. That beyond the patients that that I actually physically touch with my hands, on a broader stage, the boards, committees, associations, like I'm active in the American Society of Anesthesiology, my Texas Society of Anesthesiology, NMA. I spoke at their national convention. That was on a broader scale, reaching other healthcare practitioners on every level, from nurse practitioners to doulas to other physicians, to make sure that we are checking our own bias and advocating for culturally competent care across my specialty and other specialties in healthcare abroad. So you have a broader approach where you're addressing associations and national committees, and there's not always time for this when you're early and starting your career. You're just that's where mentorship comes in, where you're trying to find your way. So you have your one-on-one where you're going to touch a patient's life. There are always boards and committees that are looking for our input on a local level or at the actual hospital that you're at. And then you also look even broader nationally and internationally, where you have to make your voice be heard. And it gets tiring because beyond this, I still have a family and a child that depend on me. But you have to, I find it rewarding that I feel like I reach more people on these larger stages where I can affect actual change and advocate for culturally competent care, not just one patient at a time, but every platform at a time.
Yeah, I was gonna say I don't have much to add to that because that was perfect. I think the one thing that I could probably speak to is honestly, in addition to what you said, have never losing that interpersonal. I think since doing this fellowship, I have been a little more removed from the clinical space, and every time I go back to clinic, I'm like reminded how important and how vital those patient experiences and those patient stories are to fueling the work that we do. And it's not to say that the work that we do, in DEI, or other initiatives that are clearly very important in maintaining and increasing cultural competency. But I think that in addition to those efforts, I also want to kind of emphasize that it shouldn't be all on us, right? And we should have allies in this space, and we should feel compensated for our time and our work that we're putting in. And I don't think that that's wrong. I think that that's something I hope to see with kind of the new generation, and understanding that these are things that we want to see the change. And so we're going to make this happen. I can give a very small example of when I was a resident, and we were working really hard to kind of increase, quite frankly, like the representation in our residency. Because what we were seeing was not matching the patient population we were serving. And I remember there was a lot of work that came at the, on the, from residents and the folks that were in the program, and seeing the fruits of those labors and seeing that it did make a change and it did make a difference is so fulfilling. And I think that you do have to kind of pick and choose. What that experience showed me is, this is the work I want to be involved in, but I also know I can't do it all, because you do want to make sure that you still are taking time for yourself and taking time for, the clinical work that we all, got into this for. So I think balance is key to everything, and that's always a moving target for me. But finding the things that truly give you passion, and understanding that even if you're interested in it, you might not have the bandwidth, and that's okay. Making sure that you're building alliances and asking other people that might not belong to that group to, reach across and kind of pitch in this work, because we all need each other to get there. It can't just happen within our own group. So we really need to build coalition. And I think that's something that I have learned just even in my kind of early career, and something that I hope to foster moving forward.
Thank you all so much. These are such amazing answers. So our next question is, unfortunately, discrimination follows us everywhere. It's quite hard to avoid. So do you have any advice or strategies on how to navigate effectively instances of discrimination, either from coworkers, from patients, just from outsiders? How do you guys navigate things like that?
I think community, again, I'm always appreciative, and I get to wherever I go. My Howard University family goes wherever I go, but also I build community in SNMA. I was fairly active while I was in medical school, and then transferred over into NMA, and it has been a great community of physicians from all walks and specialties. And I am a traveling physician. I'm licensed in more than 14 different states. So, but I've never been somewhere, even in Bangor, Maine, I've been able to find community amongst my Howard alumni, HBCU alumni, and SNMA and NMA. So I always advise people as early as you can in your career, even down to MAPS. Like, it's a great place to build community. And I think that's a great way to start. Another obstacle we face is imposter syndrome. And mentorship, which has already been mentioned before, is a great checks and balance you definitely belong where, if you've gotten this far, you definitely belong wherever it is that you are. But I always advise people, as you move around from medical training to actually starting a career, relocating, please tap into your network, tap into your community. NMA, SNMA, HBCUs, they're a great source of community and support.
I was gonna say, I'm gonna sound like I'm repeating myself, but allyship I think is super important. I think for me, in like the few examples I can think of where I've experienced either microaggressions or things that felt or were discriminatory, I think the biggest asset I had was having allies in the room. And so whether that's people that are in the same kind of have the same demographics as me or not, but know me, I think that really went a long way. And I also worked and still work to pay that back. And so I think for me, it's really important to notice when someone is being treated unfairly and speak up for them in the room. I had experience like that in residency. I, had experience like that in medical school. And I think it's really important, obviously when you are the victim of this but also I think even more so when someone that you care about or you're witnessing in public, because it's hard for people to speak out. And when those things are happening, to understand the best way to do it, especially if it is involving patient care, I fully understand. But I always think it's important to show up for people in those spaces, because we're in a space now where we just can't kind of let those things slide anymore. I think we all need to take it upon ourselves to make sure we're educated, but also educating others on what's appropriate, what's not appropriate. And so I, kind of tried to take that up when I was in training, and I continue to do that now. And we're not perfect, but I think it's important to try.
Yeah, I agree 100%. I think the community piece and finding your village is so important. And obviously, as the postgraduate chair for NMA, I have to spend some time really particularly recognizing the postgraduate section as that perfect transition from SNMA, which is a little bit more of an organic way to find people who are sort of in the same space as you are. And the postgrad section is that soft launching pad from SNMA to NMA, where it is the space for residents, fellows, and early career physicians. So people who understand this point of transition when you're really just trying to navigate the earliest times of being a trainee. And I think that my colleagues would probably also agree as well that I've been back to the SNMA conference every year since graduating medical school and went every year in medical school, and being able to go back and provide yourself and offer yourself as that mentor and as that person who can help the next generation of physicians navigate that space sort of gives you a little extra oomph to go back and also be that person in the space that you occupy as well. So reaching back and mentoring, and then finding mentors as well. So I go to SNMA every year, I go to NMA every year, and both conferences are like family reunions that really kind of heal. Like I just kid you not, like it really is sort of like Band-Aids that soothe over like the little cuts that you might be experiencing every day, 3 or 4 days. And you're like, I didn't actually realize how much I needed just 72, 96 uninterrupted hours of people who look just like you being like, I am so proud of you. And how do we help you get to the next stage? So if and however you can, like really make sure that you are plugging into those conferences every year, just as a reset point. And then I think the other piece is, in some instances when it's appropriate, really speaking in real time and calling things out as they are. And it doesn't have to be confrontational. I think that oftentimes adults sort of fall into this space that being direct is confrontational, and that's untrue, right? So it's important for you to stand your ground and be able to tell people when they've been inappropriate or when they've said something that feels inappropriate. Sometimes it makes sense to address it in real time. Sometimes, particularly if there's an audience, it might not be received as well. And so it might be something that you need to have a conversation with later. when you're in the trickier situations, when you need to course correct someone who is your superior or your supervisor, I love a good paper trail. This is my millennial coming out, but emails are good because you've basically put everything in writing. There's no tone, there's no inflection. It's just words stating fact. And so if it does end up escalating to different places, you've got a good paper trail of what the conversation was and what the conversation was not to be able to cover your back.
That was very nice. Touching back on something you said about plugging into SNMA and NMA and things like that. Our next question would be, are there any organizations, specifically for minority women, but women in general, or being a minority in general in medicine, any other organizations that you know of that we should plug into?
I mean, there are so many, but I think that if you start with SNMA and NMA, the people that you meet there will help sort of foster you into other spaces that make sense for your particular specialties. So I don't know of many others that are like broadly across all specialties. There are some, like for emergency medicine, for example, there are spaces for like women in emergency medicine. Have some group or working group or something that kind of creates a space for women in that field, recognizing that medicine is still a male-dominated field. But to not murky the waters, I'm still going to say like SNMA and NMA is where you're trying to be, and everything else will fall into place if you start there.
So usually each specialty has their own like minority program. I'm blanking on the name, and this is really a senior moment. I'm blanking on the American Society of Anesthesiology. They have their own minority program for minority anesthesiologists, but each section, I usually default back to NMA because there's a section for whatever your specialty is, and it's phenomenal. I'm just going to keep plugging in. I know she already, but it's phenomenal to be in the room with literally 6 generations of Black women that there's no need to reinvent the wheel, that have trailblazed, and there's still more trailblazing to be done. Don't get me wrong, but it is a beautiful feeling to be in a room with 6 generation of Black female physicians that have trailblazed and done things and are there specifically, even the retired ones are specifically there to pour into you. I'm fortunate to be a fellow alumnus of Melba Swaffer, who was actually one of the first cardiovascular anesthesiologists who worked in the Binky Heart Center here in Houston, Texas, which is home to the largest medical center in the world. To be able to have that personal connection to someone in my specialty, a true trailblazer in my specialty, and actually have her number and to call her when I need her, like that's and I like to think that I'm special, but I know that that's her passion now as a retired anesthesiologist, is to pour into the next generation. So I to this day, as much as I've traveled and spoken all across the globe, there's no other feeling like that.
Yeah, I fully agree. I think a personal anecdote I have is like a few of the people that I've met at SNMA conferences from medical school. Like I kept in touch and they helped me like to get where I am today. Like they absolutely mentored me. They built connections, or they forged connections with people in the Southeast. And this was a conference and a person that I knew that was like out in California. Like the people that you meet at SNMA are very special, and they care and they are invested in your success. And I benefited like 1000% from that. And then there's also like really genuine organic conversations and relationships. I think it's in terms of networking and working on that skill, like it was so easy at SNMA as a medical student compared to any other conference, because it truly did feel like a family. There were people that I wanted to meet and obviously kind of make those connections, but it just felt a lot more warm and comfortable. And so I completely agree. I think it's probably the best place to start. And then the only places I would suggest after that would be like, depending on what your subspecialty is. And almost all of them usually will have some type of, diversity or DEI or some type of division to get involved with.
Thank you. And so for another question, we actually have a Sowing Seeds series based solely on this, but if you could touch on a little bit, how do you manage balancing the demands of your medical career with your personal life, including relationships, marriage, and parenting? Are there any strategies you found helpful for maintaining connection with your partner or family or friends and loved ones as well while handling the pressures of the profession?
Am I the only one that has children and a family? Okay. So I will say this. My life is nowhere near traditional, but I will just tell you that like I said, I'm 16 years in the game, and I love the organized chaos that is my life. That's just how I live. But what works for me doesn't work for everyone. Like I said, I am a traveling physician, but I only travel 1 week out of the month. So for 1 week, I have a great village. To make sure that my child is taken care of, a 9-year-old daughter named Ava Grace. We love Ava Grace. Ava Grace has an entire village to help her grow into this beautiful human being that I pray also wants to go to an HBCU. And for 1 week out of the month, I get to be the boss doc that I am and travel and focus on work where I know that I have, a mother, a great support system to take care of my child. And I get to go work 12, 24-hour shifts, being the wonderful physician. I love what I do. I love labor and delivery. Obstetric anesthesia is my favorite. I get to go do that. And then when I'm home, I'm the most annoying and involved Uber mom. I get to take my child to school, pick her up from school. I get to go. She's swimming is her sport right now. She's also interested in volleyball. She plays the piano. I get to do all of those wonderful things. I get to mentor. I get to be involved in my community. I get to be involved in my church. And that's my balance for me. That doesn't work for everybody. I don't think I could have done it when I was a partner, when she was a small child, when she was an infant. And I found balance that way. I do know that I'm not just Kanisha, a doctor. Most importantly, I think I value my role as being Ava. I love being Ava Grace's mom. I went to her school for career day and her friend called me, "Hey, Dr. Ava Grace's mom." And I was so proud. And I was glad that I have created the life that I have, that I could be there for a career day and I get to be classroom mom and I get to do all of the things, but that's my balance. And what I have learned is that everybody's picture is not going to look like, and sometimes it's going to be trial and error. I've worked employed physicians where I've worked for hospitals. I've been a senior partner in a partner type of situation. I played the politics of going through junior partner, senior partner, and all of those things. And now as an independent contractor and locums where I am the corporation, I am the physician, that this has been a very, very sweet spot for me. I'm at a position in my career where I don't ask for PTO. I give you my availability. I work my availability and I'm off when I'm off. And that's a hard life to create right out of the gate, but that's where I am now. And that's kind of where I've worked. I wasn't the kind of person that always knew I wanted to be a mother, a wife, or a partner or anything. But I've journaled throughout medical training in my career that I don't lose sight of the woman I want to be. Because part of that woman is a physician. Part of that woman is a partner. Part of that woman is a mother. And that is what I encourage everyone to do along the journaling is always a great way to stay in tune to who it is, the person that you've been, you are, and where you want to be. And it's great to have that community, the allyship to support you, but they can only support what you know in yourself to be what you want. So I always remind people, please stay in tune to what it is that you want to be, and your path is not going to look like everyone else's path. But we work way too hard not to enjoy this. So please make it a point to enjoy this thing called life. And I will say I've probably refallen in love with my career probably about 3 times thus far. And I knew when I had fallen out of love with it through my journaling. And I also mapped my way back to loving what I do through my journaling. So that is my little tip of advice to being a multifaceted working mom.
Thank you so much.
I do think that when you're early in the space, it can be hard to see that light and see that flexibility. Medical school is so rigid and conditioned. You've got tests, you've got class. Residency is even more rigid and conditioned. You've got, this set schedule. You're in the hospital 60 to 90 hours a week, and you may or may not be somewhere where it's easy to get to the people you care about. You may be in a different place with your partner. So I think that there's a lot of restrictions, sort of like mental restrictions, that you have to be a lot more intentional with to get through. So for me, I am single and have no kids. So for me, like, what's important for me to be that woman outside of medicine is travel, kicking it with my friends who live all across the country. And I've been able to do that pretty successfully, like even since medical school. I think because I didn't start medical school right away from undergrad, I had really defined myself as an adult first, what was important to me, which meant that when I got into medical school, I knew that I needed to make my medical school schedule, my residency schedule, work around what made me a full person. And being a student was not my identity. Being a doctor is not my full identity. Being a resident is definitely not my identity. Like, now that I am past that life, it's really nice to not have to live in that reality anymore. And so that meant just like looking at my calendar way in advance, right? So the beauty of medical school and residency is that you actually have a skeleton calendar for 12 months at a time, which will never, ever happen again. So you know when your exams are, you know when your vacations are, your day offs are. And so in med school, I remember classmates would know if we had 2 days off, they're like, all right, I'm no doubt Chinema already has a plane ticket booked somewhere. Where are you going? And they were right, because I saw it 6 months ago. And because I was on a budget, had already booked a flight somewhere, domestic or international, and knew I was like, all right, I got 48 hours. What can I do in 48 hours? And in residency, it was the same thing. We used to get our vacations in 2-week blocks. And so I was thinking, like, in April, when I put my schedule request in, I already knew that I had a vacation the following February. So that following February, like, your girl was in Aruba, she was in Jamaica, I went to Guatemala. Like, I lived very well. Well, I mean, I lived on a budget, but you can have a life. And I think that medicine makes you feel like you have to have delayed gratification and everything has to stop while you're in medical school and training. And that's how you burn out. And that's how you fall out of love with medicine. But if you can strike that balance where, now that I'm in fellowship and I have a lot more control over my schedule, I can do things with even more ease. But there are some things that you can do. And then the final piece for me was still like hard to get to see my family because I was in the Midwest for residency. I was in the South for medical school, and I'm from New Jersey originally. So that final piece of striking that perfect balance was actually choosing a fellowship program that allowed me to be driving distance from my parents. So I could like do that when I wanted to without having to put in the forethought, and then still like be a city girl when I needed to be.
You're muted.
Oh, wow, I just had a real moment. I was talking on and on. Basically, echoing what was said before, I definitely think for me, I was blessed to be near family for both medical school, undergrad, like throughout all my training and education. And so when I traveled, I really was traveling to different places kind of abroad. I also tried, I think about this a lot because when people think about med school and the whole track, they're like, my life is gonna, kind of end and then I'll come back up for air at, I'm trying to be a doctor by the time I'm 29. I feel like I lived my life throughout medical school. I think still when I look back, I traveled the most when I was like outside of undergrad and during my time in medical school. And that was because I did like externships and I tried to look for opportunities to go abroad. And and really prioritize that. And so I think there is a way to kind of marry those passions, even in the kind of rigid schedule that you have in medical school and residency. And then I couldn't agree more that it is something that you really shouldn't put everything on pause, because the things that got me through residency the most were the family, the friends, the support system, and whether they were here or far. I mean, I was in, the depths of my first and second year during the COVID pandemic. And that was like a time where we couldn't see anyone. And of course I was in the hospital all the time. And so I was like, very much an incubus of disease. And so I think for me, like that was a time where I really relied on like regular Zoom meetings with my friends and family. And that really got me through. I think that was probably like one of the toughest times of my entire life, let alone career. But it definitely was only doable because I leaned on those things outside of work. And so I think, yes, work can be fulfilling. And I do think that there are times where you're going to feel a little bit exhausted by it, and then you're going to come back and feel exhilarated by it. But I think always knowing that you are something outside of medicine, and making sure that that stays a priority as much as possible is huge. Because I think when you start to lose that identity, that's when you start to have, be more likely for burnout and kind of crisis mode. So yeah, I mean, I definitely echo kind of everything that was said before, but figuring out and journaling, I think, is huge. I think one thing that someone told me before I started residency, at the very end of, or I think during like, orientation, was to write yourself a letter that you would open at the end of residency. And I did that. And I actually really, really loved it. It was basically like, first, congratulations, we did it. It was a letter to myself, totally. But it was really funny to see kind of like the words of like congratulations I was giving my future self. And I think for me, that was something I honestly even forgot I had done until it fell out of my journal. And I was like, what is this letter? So I think that is something I highly would recommend. I tell the interns I work with now to do the same thing. Because I think that was like a beautiful gift to myself of finishing this really difficult period of my life, but also feeling like so excited about my possibilities moving forward into my career.
Thank you all so much. We are approaching our time, but there are a few questions in the chat. It's okay if we ask them. Oh,
okay. I tried to warn you. I really have to go. Can I just give my little parting segment and get out of here? Okay. So one thing, since I'm now just realizing I'm the oldest person here, I am realizing
in career, not necessarily in age, girl. Like
I'm
don't
pretty
do
sure
it.
age, because you already gave yourself millennial, so I know it's good. Good genes. I'm cool with it. So, with that being said, I realized I had, even as a training physician in medical school and in residency, I probably had some of the most unhealthiest lifestyle habits. So please, I want to serve this as a reminder to medical students, to residents, and those early in your career. Please take care of yourselves. Please go see the doctor, even if you are the doctor. As women, having more options than I had in the course of career planning. I know you got a bestie that's an OB. Talk about your fertility and journey and plan for it. And you got options and you can do it. And whatever you decide is for you and for you alone. So those are the two things that I always try to remind medical students and training doctors. And this is a personal reflecting on that time in my life. I probably had some of the most unhealthiest sleeping habits, eating habits. I was not going to the doctor trying to become a doctor. And I don't want that for the next generation of physicians. And unfortunately, in the world that we live in, there's still a lot more trailblazing that needs to be done. But know that I'm already proud of everyone here. And I made a commitment to myself that I can't retire even until I see 20 more me. And that's why I mentor. And that's why I try to stay plugged into my community, because I would love to see 20 more, specifically anesthesia. I mentor all, but I want to see 20 more anesthesiologists that not just look like me, but have a heart for culturally competent anesthesiology, just like I do. And with that being said, I bid you adieu. I can be found on all social media platforms as Dr. Kanisha, DrKanisha. It was lovely meeting all of you colleagues. Y'all are absolutely fabulous and beautiful. And thank you for all that you do. And I am happy and I hope that you consider me part of your community because I consider you part of mine.
Thank you so much. I really appreciate it.
No problem. Y'all have a great evening.
Thank you.
Are you all able to answer just the question in the chat real quick?
Yeah, is it over in comments?
Yes.
Okay.
So the first one was, I'm an inspiring anesthesiologist. What should I expect as a Black woman in the field of anesthesiology?
Yeah, I feel like that question was actually probably best for anesthesiologists who departed. It's okay. But in general, I think that to be a Black woman in medicine is what we have mentioned earlier, that you have to work 5 times as hard to get half as far, and you will, and you can. And there are women just like you who understand that struggle and who are working day in and day out and delaying retirement, like Dr. Hall had mentioned, in order to be there for you to help you get through there. So, the most important thing, if that's what you want to achieve, is to find that mentorship. Reach out to those. Social media and the pandemic has really made it great now to find new ways of connecting with people, whether it be X, whether it be Instagram, all of the things. I would find some mentorship, plug into women who will pour into you and get you through that journey.
Thanks. And the next question is, I want to know if there's something they could change about medical school, what would it be? Also residency and fellowship. That's an interesting question.
I know, I was reading it and thinking about it. I think one thing I think that they actually started at our residency program, and I think it was great, is having, I want to say, not only is our therapy sessions covered, there's usually, I think your first 6 are covered fully free with our insurance plan at our program, but they also made sure that you had wellness time and that you were able to schedule and kind of, unless it was you had an opt out if you had your own therapist, they made sure that intern year you got connected with one if you wanted and had fully protected time to meet with them. And I think that is something that I didn't take advantage of until residency, and still am seeing a therapist now and fully co-sign it for everyone. I think we are not gods, we are humans, and what we see in the day-to-day, especially in my field, I know, other fields that see especially a lot of trauma, I think that it takes a toll on you. And in order for me to be the best doctor, I need to make sure that I'm taking care of myself so I can take care of others. And so I think that is something, mental health and mental illness, these should be things that we, in our profession, especially in our kind of group, we should really try to destigmatize. And I will say, I think our program has kind of started that, which is great. So that is something that I kind of wish maybe we could have seen that in medical school, but I have seen that in residency, and I really think it's an asset.
So I have a hot take about something I want to change, not necessarily about medical school, but the process of getting in. So business schools generally require that you have a few years of work experience before you apply for business school. And I actually feel like medicine would benefit from encouraging college students to do something else first for a year or 2 years at least, just to be able to sort of define themselves as adults, really decide whether or not this is the journey and the path they want to be on, get some time to actually understand medicine and medical school, and not just the couple hours of volunteering that they did squeezed in through their college course load, but to make some really true informed decisions about this lifetime career before applying to medical school, before starting medical school. I think that there is a lot that people don't know about, specialties they're trying to get into. There are a lot, if clinical practice is something you want to do, there are a lot of ways to get there, and really being able to understand kind of the difference between going to medical school versus being any of the various mid-level providers, I think is important opportunity, things for people to think about. If you want to go to medical school, being able to work for a little bit to save up some money, take some of that stress away. It gives you interesting things to talk about during your interview for medical school. So I spent 8 years between undergrad and medical school before starting medical school, and it was not on purpose, but it is the best thing that ever happened to me. And I think that when I then went to apply for residency, I was talking about that really had informed my decision to go into pediatrics and what I wanted to do as a pediatrician came from the time that I had actually spent after getting my master's working in the school health space and understanding sort of the nuances of what my role as a doctor could be and what extra pieces I could do, like how I could leverage that medical degree, knowing that I didn't have all the answers or all the tools, but kind of where I fit in this giant puzzle of wellness for children.
Thank you so much. And this last question was also about being a travel doctor, which our travel doctor has left, but if you guys can speak to it too, that there's been an increase in rhetoric to do traveling instead of taking a staff position / contract right after residency. What are your thoughts on that?
I have so many thoughts. I think there are pros and cons of both. One of the things that we have been trying to spend some time in the postgrad section helping residents to understand is the other options that are not academic medicine of what you can do with your medical degree and with your clinical specialty. Because really all we know is academic medicine. Residency is in an academic medicine space. There is scholarship that's required for graduating. And so you finish residency and you either continue training and do a fellowship like myself, where now you're still in academic medicine and don't have a good understanding of other things that you can do, or you maybe go first to academic medicine and find yourself disenchanted by that or not getting everything you want out of it. And then you're trying to now navigate, like, what does it mean to be in industry? What does it mean to be locums? Things that sort. Now, there are pros and cons, again, for everything. I don't think that there's a one answer for everyone, as opposed to like doing some traveling versus taking a contract position. But I think that if there is a certain level of autonomy over your time, or you have certain like financial goals that you're looking at, or you have been in the same place for medical school residency and you actually want to see more, do more, and kind of just explore life, then locums or different travel positions are an opportunity to do that before you settle down into something that's more permanent.
All right. Any opinion, Dr. Depasai?
I was going to say, I think that I've heard, I think both are great options, or all of these options are great. I do think that there needs to be probably more education on that at the med school level and also at the residency level, because I do think we get told the same thing, right? That it's like you have academics or you have private practice, and those are the two kind of camps. And I don't know, but I can speak to my field specifically for OB. Private practice is kind of sold as like you're on call all the time, depending on how big your group is. It's pretty rigorous. And then depending on where you're at. And then the other side of academic medicine being like you have a larger group, so you have less call, but then you might be like overburdened with like administrative tasks and that type of thing. So I think my experience has been in those two spheres mainly. And then this past year, especially doing the research fellowship I'm doing now, has given me the opportunity to like peek behind the curtain a little bit more at locums. And I do think, especially for people who are looking for a change, I think it makes a lot of sense. I will say personally, I only know a lot more. I think it's becoming more popular in younger physicians now. I think before, and in my experience, I've only really ever seen people leave academics or leave private practice to do it because of that autonomy piece, which I think is huge, because having autonomy over your schedule, and kind of like what Dr. Hall was saying, where she's like, I don't take PTO, I just tell them when I can work and when I can't work, is big. So I think that those are things that if that's a huge, thing for you to factor, I think it's important. It's helpful to look at. But the one other thing I would kind of not caution, but I would say to think about is a lot of times for locums, at least in my field, you're working in rural areas where there's not a lot of support, not a lot of subspecialties. So it does take a certain amount of confidence, expertise, experience that sometimes you don't come out of residency with, depending on where you trained, and also just because of, you're not as far in your career. So I think those are things and challenges, just like every space that you work in is going to have its own unique challenges. That is what I have heard in my field as something that something to be aware of when you're making that decision, making that choice. So, but I think it's great. I mean, it's a great way to see different areas in the country. So, I think that there's a multitude of ways that you can blend your career, and I'm happy. I think this is a good thing to be having kind of more choices. Yeah.
Thank you all so much for all your advice, for sharing a little bit about yourselves and everything. We really do appreciate it. And thank you for your patience with the technical difficulties. And thank you for staying on and speaking with us. We really do appreciate it. And any last things you guys would like to say?
I just my final plug again. I know that we've like really hit home this idea of like SNMA and NMA for those on who have graduated medical school and are really looking to try to plug themselves into the NMA. I really encourage you to do so. You can follow the postgraduate section. We're at NMA Postgraduate on Instagram and X, and that is a way like through our link tree you can join our listserv. Just because I really do think that if your schedule allows it, you should find a way to be in Chicago, July 19th to the 23rd, which is the NMA conference. Most of the specialty sections have funding opportunities for trainees to present research that they're working on and things of that sort, where they'll cover your registration, they'll cover your flight, they'll cover your hotel. So definitely think about coming. And then generally, if you have any other questions, I want to reach out to me. I also am on social media, Dr. Chi_PEDS MD.
Awesome. And then I was going to say, I don't have too much more to add to that. I think this has been really helpful and or not helpful. I hope this has been helpful to our students, but I think SNMA truly is something that I think is a special space. And the conferences I could not kind of elevate more. So I think I'm hoping to come in July. So we'll see, my schedule pending.
Well, now you have the dates. So
that's right.
Awesome. Well, thank you all so much again for your insight on everything. Thank you for speaking on our Sowing Seeds panel, and we'll see you again soon.
Thanks,
everyone.
Bye. Good night, everybody.
Bye.